Welcome to the deep dive. Looking through the materials you sent over, one thing really jumped out.
Oh, yeah. What was that?
Well, it's something I think anyone in healthcare, especially specialists, probably feels pretty deeply. Just the sheer amount of admin work.
Ah, yes. The administrative burden. It's a constant theme, isn't it?
It really is. So, for this deep dive, we're going to focus right in on that how much these admin tasks impact healthcare pros. We'll use neurology as our main example based on what Dr. John and Dr. Jane were discussing in the sources.
Makes sense. Neurology is a good case study there.
Yeah, and our goal really is pretty straightforward. Let's try to understand what actually makes up this burden, the key parts, and then look at maybe a way to streamline things a bit, free up some of that really valuable time.
Right. And those sources, they consistently highlighted, what, four main areas causing the trouble?
Exactly. What were they again?
Well, first up was prior authorization. That whole process.
Yeah.
It often feels like wading through treacle, trying to get approvals for treatments, for meds. It's,
Takes forever sometimes.
it really does. You have to wonder how much actual patient time gets lost just battling for those authorizations. Then there's insurance verification. Necessary, obviously, but tedious.
Okay. Prior auth, insurance checks, what else?
Appointment scheduling? Sounds simple, maybe, but with specialists, follow-ups, referrals, it gets complicated quickly.
I can imagine.
And the last one was revenue cycle management. Basically making sure the practice actually gets paid properly and, on time for the work they do.
Got it. So prior auth, insurance, scheduling, and getting paid, that covers a lot.
It really does. And it eats up a lot of time and energy.
Okay, so let's dig into this a bit more. What really struck me from what Dr. John and Dr. Jane were saying was this underlying conflict, this tension it creates.
Mm-hmm. Tell me more.
Well, you have these incredibly skilled people, right? Neurologists dealing with really complex stuff, epilepsy, stroke recovery, those tough neurodegenerative diseases, MS, chronic migraines.
Yeah, conditions needing deep focus, specialized knowledge.
Yeah, exactly. But then they're constantly getting pulled away from that critical work by, well, paperwork and admin tasks. It feels kind of backward, doesn't it?
It really does. The people focused on the most complex health issues are spending so much time on essentially bureaucracy.
Makes you think about the knock-on effect for patients.
Absolutely. And if you connect that to the bigger picture, like you said, there's this clash. The whole point is high-quality patient care, especially in fields like neurology, with these long, detailed treatment
On
plans.
long-term stuff.
Yeah, exactly. And that clashes with the constantly growing demands of just getting the administrative side sorted. It's this balancing act. And sometimes, like the sources pointed out, the admin stuff can actually cause delays in care.
That's worrying.
It is. Imagine being a patient or their family waiting for a crucial appointment or treatment that's held up just because of paperwork. Adds a whole layer of stress.
Definitely. Dr. John actually mentioned that appointments or treatments getting pushed back because of admin backlogs just feels like the system's focus can accidentally shift,
Yeah.
away from the patient's immediate needs towards just ticking boxes.
That's a good way to put it.
And Dr. Jane brought up another really important point, too, the risk of mistakes. Human error. When staff are juggling complex care and all this admin,
Things can slip through the cracks.
yeah, like incorrect billing codes, maybe missing info on a form, claims getting denied. These aren't just small oopsies, right? They can have real financial impacts.
Oh, absolutely. For the practice, definitely. But also potentially for the patient if they end up with unexpected bills or delays in getting coverage sorted.
So it really makes you ask, what's the actual cost of all this admin burden?
That's the key question, isn't it? It's the hours, for sure.
Yeah.
Time not spent with patients, time not spent maybe researching or collaborating.
Right.
But it's also, like we touched on, the potential for burnout. Staff getting overwhelmed by work that isn't why they went into healthcare in the first place.
That's a huge factor.
And think about patient satisfaction, too. If they face delays, billing errors, it doesn't exactly build confidence. And ultimately, you have to consider the impact on the quality of care itself if a doctor's attention is split.
Yeah, their main focus gets diluted. Okay, so we've laid out the challenges pretty clearly. The obvious next question is, what can actually be done about it? Dr. John specifically asks Dr. Jane about this, right? Looking for solutions, especially for neurologists who seem to have particularly complex documentation needs.
Yes, he does. And that's where Dr. Jane brings up this idea of outsourcing some of these services.
Outsourcing, okay.
Yeah, the concept of basically handing off these specific defined admin tasks to an external company that specializes in them. The whole idea is to let the healthcare team Focus back on the clinical side.
Right, focus on the patient care mission.
Exactly.
Okay, so let's get into the specifics then. What kind of tasks does this company Dr. Jane mentioned, uh, Staffingly Inc.? What do they actually handle according to the source?
Well, according to Dr. Jane, they focus on precisely those 4 areas we talked about earlier.
Ah, okay, the big 4.
Yep. Insurance verification, prior authorizations, appointment scheduling, and that whole complex revenue cycle management piece. It sounds like they target the main admin headaches.
Gotcha. Taking those time suckers off the practice's plate.
Precisely. And the sources really emphasize how helpful that could be in a field like neurology. Think about those really expensive treatments Dr. Jane mentioned.
Like the MS drugs or advanced scans.
Exactly. Getting insurance verified for those can be super complicated and take ages. Having a team that just does that day in and day out could be a big help.
I see. Same for prior authorizations, I guess.
Definitely.
Yeah.
You often need prior auth for those advanced treatments or procedures, and if that's not handled efficiently, it can mean serious delays for the patient.
So it sounds like it's not just about dumping tasks, it's about getting specialized expertise to handle them better. Dr. Jane mentioned Staffingly has a trained team focused just on this stuff.
Right. And that leads to another interesting point. She made the idea of customized service.
Customized? How so?
Well, it suggests they understand that, a neurology practice isn't the same as a primary care clinic or a cardiology group. They might have different billing codes, different authorization patterns.
Ah, so they tailor the service to the practice's specific needs.
That seems to be the idea. It's not a one-size-fits-all thing, which adds a lot of potential value, doesn't it?
It really does. And when Dr. Jane called it a potential lifesaver, that really says something about the pressure these practices are under.
It does. It underscores the level of stress involved. And she also mentioned round-the-clock support.
247. Why would that be important for admin tasks?
Well, patient needs don't stick to 9 to 5, right? Maybe an urgent authorization request comes in late or scheduling needs adjusting over a weekend. Having that continuous support could be important for smooth operations.
Okay, that makes sense. Now, the thing that really made me sit up was the potential savings. Dr. Jane mentioned, what, up to 70% reduction in admin costs?
Yeah, that's a pretty staggering number.
It is. I mean, what could a practice realistically do with savings like that?
Well, if we think about the bigger picture again, savings like that could be genuinely transformative, especially for, say, smaller or independent practices.
Right.
As Dr. Jane suggested, that freed up money could go almost anywhere. You could hire more nurses or clinical support staff directly helping patients.
Okay, invest in people.
Or invest in technology, maybe newer diagnostic equipment, better electronic health record systems, or just reduce the overall running costs, which could potentially even make care a bit more affordable down the line.
And what about the time saved? That's got to be valuable too.
Hugely valuable. Practitioners could spend more actual face time with patients, have more thorough consultations, or maybe use that time for their own professional development, keeping up with medical advances.
Lots of potential benefits there, but of course there's always the security aspect, handing over patient data.
Absolutely crucial. You can't compromise on that.
So what did the sources say about Staffingly and, hypo and data security?
It was definitely mentioned. Dr. Jane stressed that they reportedly ensure full HIPAA compliance and take secure handling of patient data very seriously.
That's reassuring. It has to be a top priority.
Non-negotiable. Knowing a potential partner gets that and apparently has robust systems and trained staff for it, well, that's essential for peace of mind. The source mentioned their team is trained in healthcare operations generally, reinforcing that they should understand the sensitivity.
Okay. So for our listeners then, if you're out there maybe running a practice or working in one and you're feeling swamped by these same issues, the endless prior auths, the insurance calls, the scheduling puzzles, the billing headaches.
Yeah, if that sounds familiar.
Then this conversation between Dr. Jon and Dr. Jane really shines a light on maybe looking into outsourcing as a serious option. Dr. Jane gave that specific website, staffingly.com, as a place to get more details.
Right. And the core idea, what's really interesting, is this possibility of strategically offloading those necessary but, let's face it, non-clinical tasks.
To get back to the main job.
Exactly. To let healthcare professionals truly get back to focusing on delivering excellent, compassionate patient care. Staffingly, Inc. is just one example shown in the source of how this could work, offering that suite of services to cut down the admin burden.
Okay, so wrapping this up then. The central issue we've explored is pretty clear. This heavy administrative load in healthcare really does pull focus away from patient care. And it hits hard in demanding fields like neurology, where you've got complex long-term treatments and delays caused by paperwork can have really serious consequences.
Definitely a major challenge.
But this idea of outsourcing, using a service like Staffingly, as discussed by Dr. Jane, presents a potentially interesting way forward. They reportedly tackle those key time-consuming jobs, insurance checks, especially for those pricey neurology treatments, prior authorizations, scheduling, managing the money side.
The key pain points.
And the potential upsides highlighted were pretty significant.
Wow.
Running things more efficiently, fewer delays for patients waiting on approvals, services tailored to the practice, maybe being a lifesaver for swamped teams, having that 204/7 support, potentially cutting admin costs by a huge margin up to 70%, and then being able to reinvest that time and money.
Reinvesting in clinical staff or patient care improvements.
Right. All while, crucially, keeping patient data secure and meeting HICO rules. And again, that website mentioned was staffingly.com if people want to look into it.
Which brings us to maybe a final thought, kind of echoing where Dr. Jon was heading at the end of the material you shared.
Yeah.
It's really a question for everyone listening, especially those working in healthcare. Given these ongoing administrative hurdles and considering potential solutions like the ones we've discussed, how can you, in your specific situation, best navigate all this complexity? To really keep the focus firmly on patient care, how do you ensure the best outcomes for the people you're trying to help?
That's a really important question to reflect on.
It really is. Something to keep in mind as you carry on with that vital work.